A messy dispute between Bon Secours and Anthem is about to get even uglier. Good evening, I'm Regina Mobley.
And I'm Stephanie Hudson. Bon Secours went out of network with Anthem for its Medicare patients earlier this month. Now the hospital system says it will go out of network for Anthem Medicaid patients on October 1st. Here's what I found out today about the negotiations and what you need to know if you're one of these patients. The gloves are coming off as Bon Secours and Anthem duke it out over money. And some of Hampton Road's most vulnerable patients are on the ropes. 11,000 Anthem Medicare patients are now out of network, and 35,000 Medicaid patients could be on October 1st.
They're really in a state of panic, and I think that they really just want to know how to stay with us or how to facilitate care elsewhere.
Dr. Anand Kapoor sees patients who are affected but is not involved in negotiations.
We have a mission that's dear to my heart, helping the underserved, good help to those in needs. And I think that we do a really good job at it.
But Anthem accuses Bon Secours of using vulnerable patients as pawns to negotiate better reimbursements in the private sector.
I can't imagine how scary this is for our members. And so we try to stand in their shoes every single day.
Company president Monica Schmuti says Bon Secours is demanding money from employer-based plans to keep the others. She uses a family cell phone plan as an analogy.
And if you don't pay more, in this situation, the company is threatening to cut off service for maybe your mother or your daughter or your spouse.
The hospital system strongly denies that, telling Wavy via email, "We're advocating for our ability to continue providing access to high-quality care to some of our most vulnerable communities." Bon Secours says its labor costs are up nearly 10%, operating costs almost 7%, and Anthem's reimbursement rates are substantially less, they say, than other insurance providers. As the two sides continue to trade punches, neither want any patients out for the count and offer help to keep them in the fight for their own health and well-being. Right now, Medicaid and private employer-based Anthem patients are still in network with Bon Secours. If you're worried about losing your provider in October and you have questions about how to keep them or about maybe switching to a new provider or a new insurance plan, we have several phone numbers for people who can help answer your questions on wavy.com.